Welcome to Body Clue, where your health speaks first. Today, we're diving into a critical topic: stroke, golden time, and the FAST rule. Every year, millions of lives are disrupted by stroke. But what if you could recognize it early and save a life, perhaps even your own? A stroke happens when the blood supply to a part of your brain is cut off either by a blockage or a burst blood vessel. The brain, lacking oxygen and nutrients, begins to die within minutes. That's why time is everything. This is where the concept of the golden time comes in. If a stroke patient gets proper medical treatment within the first 4.5 hours after symptoms begin, the chances of recovery skyrocket. Delaying treatment, even by an hour, could mean the difference between full recovery and permanent disability. But here's the catch: the early signs of stroke are often subtle. People think they'll feel better or wait to see what happens. That's a mistake. So how do you spot a stroke? Remember the acronym F.A.S.T. F is for face. Ask the person to smile. Does one side droop? A is for arms. Ask them to raise both arms. Does one drift downward? S is for speech. Ask them to repeat a simple phrase. Is their speech slurred or strange? T is for time. If you see any of these signs, it's time to call emergency services immediately. The problem is, only 30 to 40% of patients actually arrive at the hospital in time to receive the most effective treatments. That means up to 70% miss their chance. And stroke doesn't discriminate by age anymore. It's not just a disease of the elderly. Poor diet, smoking, stress, and lack of exercise are pushing cases into younger age groups, even people in their 30s and 40s. Q1. How can you tell if someone is having a stroke? Stroke symptoms appear suddenly and vary depending on the affected part of the brain. Common signs include weakness or numbness in one side of the body, difficulty speaking or understanding speech, slurred words, imbalance, blurred or double vision, dizziness, and severe headache. Immediate action is essential. Q2. What should you do when symptoms appear? Act fast. Call emergency services or go directly to a large hospital. Keep the patient calm, loosen clothing, and if vomiting occurs, turn the head to the side to prevent choking. Q3. Why are more young people getting strokes today? Poor lifestyle choices like unhealthy eating, lack of exercise, smoking, and chronic stress are increasing stroke risk in people as young as their 20s and 30s. These factors accelerate conditions like hypertension and diabetes. Q4. Is stroke hereditary? Stroke itself isn't inherited, but the risk factors can be mainly due to shared family habits. Keep the patient calm, loosen clothing, and if vomiting occurs, turn the head to the side to prevent choking. High-salt diets, smoking, and sedentary lifestyles increase family-wide vulnerability. Q5. What treatments are available at the hospital? Treatment depends on stroke type. Ischemic strokes may be treated with clot-busting drugs or endovascular therapy. Hemorrhagic strokes might require surgery to relieve pressure. Prompt diagnosis using CT or MRI is key. Q6. What is the prognosis after a stroke? Outcomes vary. About 10% recover fully, another 10% suffer severe disabilities, and the remaining 80% can improve significantly with rehabilitation, depending on age, health, and support systems. Q7. What is a mini-stroke? A transient ischemic attack, TIA, causes temporary stroke-like symptoms that resolve within 24 hours. It's a warning sign, 10% of TIA patients for a major stroke within days. Don't ignore it. Q8. How can you prevent a stroke from recurring? Follow your treatment plan. Keep taking medications and manage chronic conditions like hypertension or diabetes. Avoid smoking, limit alcohol, eat well, and stay active. Q9. Why is the golden time so crucial? The longer a stroke goes untreated, the more brain cells die. Within the first 4.5 hours, patients may receive clot-busting therapy with better outcomes. After that, treatment options narrow, and risks increase. To summarize: 1. Know the signs of stroke. 2. Remember the FAST rule. 3. Don't wait, call emergency services. 4. Manage your health to reduce your risk. You have only one brain. Protect it. Turn knowledge into action. Share this video. It could save a life. Thank you for watching. Take care of your health, stay alert, and don't ignore what your body is telling you. Subscribe for more vital health insights.